I would like to officially welcome you all to today's session on battling brain fog. We are joined today by Meaghan Arnold, who is a speech, swallowing, and neurological rehabilitation specialist. She is a practitioner in Tyler, Texas, and she has a bachelor degree of science from the University of Arizona and a master of arts degree from the University of Texas, Austin. And she brings over 8 years of experience in skilled nursing facilities, home health, and outpatient settings. Meaghan specializes in treating voice, swallowing, speech, language, cognition, and memory deficits. She's passionate about her person-centered care and community education, hosting 2 support groups and speaking at local events to advocate for her patients. She is also, as of very recently, joined MSU's Board of Medical Advisors. And we are very excited that she has, and we are happy that she is here with us today. So without further ado, I am going to turn this over to Meaghan, and we will begin. Thank you.
Awesome. Well, thank you. That's quite the intro. I'm happy to be here. Thanks for having me. Okay, bear with me while I share this momentarily, like I'm good with technology. All right, let's do it. Okay, everything look okay? All right, well, welcome guys to Battling Brain Fog. I am very excited to be here. We'll kind of move quickly through this slide because Jessica really just covered everything about it. I will say I will come at this from the lens as an outpatient therapist. I spend most of my time with respectively healthy enough individuals that they get to our clinic or they Zoom or telehealth with me. So when we talk about an acute flare-up or a big change to functional health, we may be looking at something a little bit differently, but for the most part, our lens today is really going to be, okay, I'm going about my everyday life. So as Jessica kind of said, I am the owner of a private practice here in East Texas. I work exclusively with the adult and aging populations, and I am excited to chat about this. So here we go. All right, this is just a little bit of the agenda for the day. So what is brain fog? Our cognitive load, which we'll spend a little bit of time talking about, energy management and maintenance, strategies, cognition and memory in a little bit more detail, and then what do we do? So here we go. All right, brain fog. So it is typically a symptom of a medical condition that then causes things like difficulty concentrating, focusing, listening, difficulty multitasking, which we'll talk about, a change in memory. I'm more forgetful, difficulty completing our work or household responsibilities. So if we're somebody who still is working part-time or full-time, and it's becoming more and more difficult to manage that, if we're somebody who works in the home or is staying at home due to illness, is it harder for me to just complete my daily tasks? Losing our train of thought is often something we're going to associate with brain fog, feeling slow, and fatigue. And I thought I would just outright define that for us today because it is something that becomes kind of like brain fog. We use it, we talk about it. Medical providers are quick to throw it around, but we won't give it a proper diagnosis. So fatigue, a constant feeling of exhaustion that impacts energy and motivation and concentration and mood. And rest has much less effect on the impact of chronic fatigue. So me going and taking a nap or me having a great night's sleep isn't going to allow me to wake up just refreshed and rejuvenated when I'm experiencing chronic fatigue. So what causes brain fog? A lot of different things contribute. Certainly things can contribute simultaneously. Certainly an autoimmune disease, a myositis, a lupus, a COVID. Long COVID we're seeing right now is getting more attention in terms of individuals reporting brain fog following. So if we're somebody who has myositis and we've also had COVID and we feel like these symptoms are compounding, they may be working together, quite honestly. Mild cognitive impairment, medications can cause a side effect for brain fog, whether it be something as drastic as chemotherapy or an over-the-counter prescription, concussions, traumatic brain injury, stress, and then certainly other mental health conditions, anxiety, depression. The range is pretty great. So something I want to spend some time talking about today is cognitive load. And that is a fancy way to say how much brain power does this task require. It's the amount of mental energy we need, the amount I have to do to get this task done from a brain and cognition perspective. So some general pictures there for you, but there is a different amount of cognitive load for each task you're going to do every day, whether that be going to the doctor, talking with a friend, simply taking your medication, having a difficult conversation, interacting at work, being with your family. They're all going to require a different amount of cognitive load, which we'll break down here. We like to break it down into 4 different kind of important entities to consider when I go, okay, what's this task going to require from me? Internal distractions, fatigue, am I waking up feeling pretty bad? Physical discomfort. For those of you who experience chronic pain, that physical discomfort is already going to require a certain amount of cognitive load, or take some cognitive load in order to help us participate in what it is we're doing. Emotional state as well. So if I'm anxious, if I'm nervous, if I'm excited, if I'm happy, all of those internal distractions are going to require us to manage them. And if I'm managing those on top of doing a task, how much is this task going to take? Environmental distractions, are we in a loud place? Is it quiet? Visually, am I in somewhere that's distracting? Am I at a restaurant? Am I in a train station or an airport? Or am I in my room? Smell, ideally we're smelling nice things, but if we're somewhere where somebody's wearing a heavy perfume or it does not happen to smell nice, it's gonna require or change the amount of cognitive load we've got to give. And same thing with technology. Am I getting an email that pops up on my screen every 10 or 15 minutes when I'm supposed to be doing something else? Am I getting a notification on my phone? So we'll talk about how we'll manage some of those environmental distractions. Those are some of the ones we have a little bit more control of. Same thing with cognitive demand. Let's talk about the complexity of the information I have to participate in and understand. If I'm in a meeting at work and we're going over a brand new spreadsheet, that's going to require a completely different amount of cognitive energy than if I'm at home watching an episode of Friends I've seen 16 times. The amount of information as well, right? If it's a 10-minute conversation, that's great. If it's 2.5 hours, that's a different story. Is the information new or not? So how familiar something is to us. Again, if I'm rewatching a show, I'm good. I can go on autopilot. This isn't going to require too much of my cognitive attention to understand what's happening. If it's brand new to me and I've never learned it before, I'm going to have to address this totally differently. It's going to require a completely different amount of attention. And then how high are the stakes? Again, if I'm at home and it's casual, they're pretty low. If I'm going to lose my job because I don't understand how to do this, or because I'm not performing this portion of my task well, a lot higher stakes. And then finally, certainly as a speech pathologist, we always consider the communication demands. How many people am I speaking to? If I'm at a social gathering and it's just 2 of us, or there's 16 of us, am I going to have to manage conversations and questions from multiple people next to me? The speed of those conversations, am I going to have to work really hard to get a word in edgewise? And then the conversational format, this right here, the conversation demand for you guys, pretty low, for me, a lot higher. So we want to take all of those things into consideration for what we'll talk about here in just a minute, but understanding how and where you are using your cognitive energy will help us when it comes to managing that brain fog. You may have heard before, it's the straw that breaks the camel's back. When we talk about going through our daily routines, and it's all pretty routine, but I'm still feeling exhausted, or I'm still forgetting these important things. When we pull all of those things we do back to their basic level and we talk about, okay, how much does this require? Oftentimes people are surprised. The cognitive load to get things done, especially if we have a chronic disease or disorder, is really impactful on our quality of life and our ability to get things done and our ability to manage our responsibilities. Managing cognitive fatigue. Why we're here, right? Brain fog. So, something I stress to everyone when there is a medical reason we're experiencing brain fog, and there doesn't have to be for us to validate it, don't get me wrong. But when we do have an autoimmune disease or chronic pain or long COVID, pushing through fatigue will just further impair functioning. Before experiencing cognitive fatigue or brain fog, we could probably have a cup of coffee and then, kick it into high gear and get things done. What we see is that the body just doesn't respond the same way. And so we need to, one, acknowledge that if we'd like to implement functional change, and two, give yourself a little bit of grace. You're working really hard. When we hit that point of fatigue, we want to honor it. We may need to edit or change our schedule a little bit, and then we're going to make plans and how we accommodate this fatigue. But pushing through is no longer something anybody should be recommending. Certainly if we're driving home, we probably want to get home. But outside of that, if we're like, okay, I'm supposed to get this, responsibility for my job done, and it's not due until the following day, but I'm done today, I promise you'll have more errors to correct if you continue tonight than if you just wait until tomorrow. And we'll talk more about that. Building rest breaks into your schedule. I can't stress this enough. Rest is functional. And that's hard for people, especially individuals who are still working full or part-time, individuals who are used to being able to push through, people who didn't need rest before brain fog or before a different kind of illness. Rest is functional. We need to be honoring rest just as much as we are honoring the work we're doing, because the rest is allowing you to do it. So if we're not building that in often, we're going to talk about that. We do like some mindfulness-based stress reduction. That's a quick Google that really anybody can do, but we've seen success with that for individuals with medical diagnoses. So again, I'm a neurotypical 33-year-old. It'd still be nice for me as well. But if I had an autoimmune or a chronic illness, I'm leaning on that a little heavier. We do want to create a sleep schedule. We do want to avoid overexertion. We want to do better with medication management if that's not something we're doing already. A lot of those medications, especially if they're helping with pain management or how we're feeling, if we're not taking our meds on time and we're experiencing an increase in pain or an increase in discomfort or an increase in anxiety, we're automatically going to have a harder time managing the things we need to do. So taking our meds on time, not missing, over or under diagnosing, is a huge way we can start and end our day with that little extra control and much better functioning as a result of it. We also love a routine, and we'll talk a little bit more about that. The spoon theory. So I know y'all just had a fabulous set of videos or webinars about fatigue. The spoon theory is another way. I think the way that she previously recommended was something called pacing. And I think that sounds pretty fabulous. And if you like that, whatever works for you is whatever works for you. There's no wrong answer if we feel better and we're doing better. The spoon theory was created by a woman who has lupus, a chronic autoimmune disease, to talk and describe physically about how her day went and about how she was able to get things done. So I am incredibly partial to the spoon theory. I will tell you, I use it in my clinic every day. We walk people through how we implement this. So a spoon essentially represents a unit of energy, and each daily task requires a different amount of energy. And quite honestly, we could do a completely separate webinar on what this is, and I'll touch on it a little bit in the next slide as well. But this is also a pretty lovely and easily Googleable theory or way of managing cognitive fatigue. So if you're interested, continue to look this up. It's great. I also have several resources I'll leave at the end that I certainly have not made, but that we lean on because they're clear and functional. For a person with a chronic disease or a chronic illness, ideally somebody is using 12 spoons a day. And rather than a task being big, little, or small, we assign a unit of spoons, which is not a time unit and people have a hard time with. But we assign an amount of spoons to each task. So for me personally, getting up in the morning, getting ready for work, it's like 1 spoon. Being at work all day, about 4 spoons. I have 2 small children, so putting them to bed is like 10. Just kidding, but it's probably about 3 spoons when we're not cooperating. But as a neurotypical human, I really have a lot of spoons to give. I have a lot of spoons that I can use and still be pretty functional. We want to use the spoon theory to prevent hitting that wall every day. And so the way we often recommend somebody going or starting their spoon theory journey is we take all of our daily tasks and we assign them a number of spoons. And don't get me wrong, spoons might change on a daily basis. Again, I have toddlers. So if they're cooperative, whatever task we're doing is easy. If they're not, it's drastically harder. For somebody with chronic pain or experiencing a flare-up, when we're doing that flare-up, getting a shower and getting dressed may all of a sudden cost a lot more. And if we have that understanding, we're not only planning our day around about a 12 spoon maximum, but we're planning our week. I know that if I have to go to the doctor on Wednesday and I have a deadline for work on Thursday, I am taking Friday pretty easy, and I'm probably taking Tuesday pretty easy, and I'm going to do the best I can to break up the big tasks across several days. I will also say, I'll call it a fatigue hangover. But on the days where we have a lot of things, I have to go to the doctor, I have to work for 4 hours, I have to go to a family dinner that requires quite a bit of socializing. That next day, if we are slower, having a harder time getting our responsibilities done, having more difficulty finding that word that's on the tip of our tongue, that's to be expected. That is a fatigue hangover, you know? And when we're working with brain fog, we're working with cognitive fatigue. The name of the game is, what can I control with the energy that I have? And our goal is always to get you more consistent, reliable energy so that we can manage through that fog. So this is a very general, broad example where, you know, getting dressed would be a spoon, socializing with friends would be 4, going to the doctor is 4. There's no wrong or right answer here. Each person's spoons will be individualized. And I will say this as well, and I would imagine it is the same for pacing. Implementing cognitive fatigue management skills is unfortunately not easy. Just like everything, when we go to learn something new, it requires effort and energy. So oftentimes and we'll talk about other things we can be implementing almost right away to help with brain fog and navigating through cognitive fatigue. But when we change a habit, we're changing a habit. So it is going to take a lot of time and effort during the first 2 or 3 weeks. I think if mentally we can plan for that and give ourselves some grace, I can guarantee you it's worth it. Sometimes we've got to give ourselves grace and go, I'm really tired and this isn't working and I'm going to try tomorrow. But the more consistently we try and the better we implement it, the better we feel, the more streamlined other processes happen. And I will say this forever, but 15 or 20% better is just that. It's better. You know, and if we feel 15% better on a daily basis, and that compounds, and we can help with some of that chronic fatigue and the way that our cognitive fatigue is affecting our quality of life, in a month or 2, you're going to look back and go, ooh, this is a nice change. It's going to be labor intensive, but it is absolutely worth your time and energy when we can do it and when we get our brain kind of set to get it done. So let's talk strategies a little bit more specifically. We'll break them down kind of across the board. We do love some low tech and some high tech strategies. We'll also talk about internal memory strategies and external memory strategies. We will talk too about streamlining some processes. And it is one of my favorite things. There will never be a day I offer you something that is just mind-blowing. We love simple solutions because they're usually something we have in our house or something we can get pretty quickly. But our whole goal when we talk about battling that brain fog, getting through the day, is making processes a little bit more simple. The other thing we'll talk about certainly is, and we've touched on it already, is cognitive fatigue management. The spoon theory is, I can't stress it enough, it's incredible. People usually have a hard time with it for about 2 weeks, and then it starts to click and you're like, okay, I got it. And then multitasking. Reasons to avoid multitasking. We have lived in a culture that has perpetuated the importance of multitasking and being as efficient as we can be for a very long time. And now, quite honestly, like a lot of research continues to recommend against it. So when we multitask, our performance drops, quite honestly. You're slower because you're operating between two tasks. We are trying to keep up with where I left off over here and where I left off over here, but did I do this over here? I'm in the middle of this over here. We have a higher frequency for mistakes. We are less likely to be creative or innovative. So if you're really sitting there thinking and we're doing something for our job, or you happen to be a creative person, which I am not, but we need those juices to flow, multitasking is going to pull from that. It's also going to be more difficult to remember and learn when we are constantly switching between tasks. So ideally, we are limiting distractions, and that goes back to the environmental distractions. If I'm in a noisy environment, can I get quiet? If I'm in a place where there is a lot of visual distractions, can I go somewhere where there aren't a bunch of people moving around me, or the TV is off, or I've closed the window to see my neighbors outside? The more we can just do one thing, you're going to do that one thing better. You're going to do that one thing faster. You're going to do that one thing more accurately. And then we don't have to go back and correct our mistakes, reread what I was doing, make sure I'm picking back up at the same place. Obviously, that's an ideal situation. There are times where it's not possible, but in the times where it is, you're going to save yourself a ton of mental energy. And at the end of the day, that's how we battle brain fog. If I can control how I'm using my mental energy, I'm going to function better. I'm going to have a little bit more reserve. The more I practice, the more I'll have. But it really is this worth using my cognitive energy on today? Do I have the ability to do it? So here are some of my favorite external memory aids, and they're all pretty simple. Again, there won't be a day where I present you with something that's just mind-blowing, but the way we're using them is pretty fun. So something like a Bluetooth tracker would be like those Apple tags, whether you're putting that on your car keys or your wallet or in your purse. They are incredible. Where did I put my phone? Let me just find it on the thing. A calendar and a planner, depending on what kind of human you are. If we like to use a phone calendar, great. If we like to write it down on paper, great. I love an Alexa or a Google Home. We do work often with people who are technology resistant. So for the people who don't love a smart device, we can still work around it, but it's hard to beat not having to get up and saying out loud, "Hey Alexa, remind me in 15 minutes to turn off the oven. Hey Alexa, remind me in 30 minutes to get up and take a 5-minute walk. Hey Siri, set a 5-minute timer so that I know that I'm going to come back to work." Better make sure she's not listening. A notebook, if you are somebody who is writing something down on paper and that writing process helps get that out and done for you, great. But if writing something down is using too much cognitive energy, again, let's lean on a piece of technology. I love an alarm and a timer. If I have been off lately on taking my medications at the right time because I'm feeling extra sleepy, I am moving my medications to my bedside table and I am setting an alarm for that time so that I am waking up, picking that med up, taking it, taking a sip of water, and then if I need to, I'm going back to sleep. But we love it. A smartphone, the same way. Now they've gotten so good, I can go ahead and add a specific food to my grocery list verbally. I can use my smartphone, and if I am still working a full-time job and I have a priorities list, I can use several different apps to help keep me on track, make sure I'm not missing anything, provide me with a visual feedback for what I have done and what I haven't done. I love a Post-it. We have a blue colored Post-it we use all the time, and sometimes I don't even write anything on it. I just have it there and it's next to me and I know that's what it needs to be. Otherwise, you can absolutely write down what you need. I'm gonna bring home a pizza tonight and some extra diapers. Got it. And otherwise I would walk out this office and not even think about it. Same thing with a whiteboard. easily attainable, erasable, easy. Internal memory aids are a little bit different, and they do require, in my opinion, and actually a lot more cognitive attention, but they're great to use nonetheless if that's what your preference is. So repetition. So I know that if tonight I have a meeting at 7 p.m., I'm going to say, okay, tonight I got that meeting at 7 p.m., 7 p.m., 7 p.m. A visualization, I might picture myself sitting down for that meeting. I'm going to picture who's sitting across from me as I go. Association, what am I going to associate that meeting with? I'm going to sit there and go, okay, this meeting tonight is to talk about, you know, the homeowners association and what we're going to do with everybody's lawns. And I know that I'm excited to be there. Categorization, this meeting is not work related, it is home related. What else could I categorize? We could also then take that and do a grocery list. So if I know that I need 2 things from the dairy aisle, I need cheese and I need milk, I'm going to go to the dairy aisle because I need cheese and milk, right? I'm just going to categorize them straight like that. Same thing with if I need meat and fish, that's what I'm getting from my protein. Elaboration. Okay, I have a meeting at 1 today. What's that meeting about? That meeting is my presentation on brain fog. I'm going to be giving it. It's for the myositis community. Okay, so if I elaborate on the topic, we're just going over detailed so that as I speak it to myself, either out loud or in my head, the more I elaborate on it, the more I'm going to remember what I'm talking about. And then a mnemonic. So, you know, what are the first letters of whatever it is I'm trying to remember? And I'm going to put those together and keep it going. So if I need chicken, apples, and grapes, CAG, CAG, chicken, apples, grapes, let's go. That's all I need. So those are, again, these take practice. These we don't just remember as we walk out the door and all of a sudden start using well. These are things we would recommend picking 1 or 2 and going, okay, I'm going to utilize this one today. Let's see if this helps. Not every strategy is going to help every person. They are individualized, and doing one thing once, never going to make a difference. So every time I talk to somebody about improving cognition or managing cognitive fatigue or, you know, working with brain fog, I always say, let's commit to a 2-week period. Try this thing every day for 2 weeks. And if we hate it, throw it out. We're never going to use something we hate. But we have to try it enough to see if it's actually going to be effective. If I went out and tried to throw a football well one time once, or even once a week, still not great. If I do it every day for 10 minutes, still not super, but better and functional, right? We've got to give what we're going to try a chance if we'd like it to be successful. So our external memory aids are really kind of set it and forget it. And we love those. Internal, I think, require a little bit more work and time, but can be just as functional. Sometimes I am walking out the door and I don't have a Post-it, but I need to remember something. My favorite is repetition and elaboration. Why am I doing this? What am I doing it for? When am I going to do it? Who am I going to see? Who needs me to do it? And I'll say it out loud. I love what we would call, you know, just oral narration, just talking to myself because I need to get this done, right? But it's effective for me. And again, not effective for everybody, but what works for you. And when we have difficulty with brain fog, when we have difficulty with cognitive fatigue, what worked for us before might not work anymore now. You know, we may used to say, well, I could do this, no problem. I never forgot this. Well, if we're in a different place, let's operate differently. It doesn't mean that we can't maybe get back to where we were. You know, if we're in a flare-up, if we're experiencing a more acute change to function, there is a likelihood we get back to being able to operate the way we used to. But there's also a chance we won't. And I think it's unnecessary for us to struggle through something because we didn't have to use the things now that we had to use before. We have tools at our disposal. Let's use them just as they are. They're tools to make our life easier and better. They're just different tools than we needed previously. Cognitive training. Let's talk about brain games a little bit. There are a lot. It's a huge business right now, both nationally and internationally, to do something like cognitive training using a brain game. And let's go through some of these questions to make us maybe a more mindful consumer of what it is we're doing and why. So a few questions I always recommend people ask themselves while they're doing it. What are these games training? Are they training me to recall a specific amount of information after a specific amount of time? And it's very specific information. Because if that's the case, if you like it, great. If you enjoy it and it's something that makes you happy, I'm never going to be somebody to say stop doing what makes you happy. But we know based on all of the research we currently have that those games won't generalize out of that particular setting. So if you're having a problem remembering to take your medication on time every day, that game was never going to fix that problem for you. And instead, we've used a lot of energy to do that game or to work on that skill that won't ever fix our problem. So I have people who also love things like Sudoku or word searches or word puzzles. And again, if you like them, fantastic. If that's what we do in our spare time because it's a hobby, great. But those things will categorically not improve our ability to remember that woman's name at church or, work more efficiently on the project I have to get done for work. They just will not. It's not how it works. So if we're looking to improve, how quickly we're able to, again, read an article in Texas Monthly and then remember what I've read, oftentimes those games are not going to do that either. Now, if you're doing a specific reading comprehension game, sure. I have not come across any of those. So we want to look at, and I will say this, all of the research I'm aware of that I've seen is done on neurotypical individuals. So individuals who do not have a diagnosis of any kind. And I think that's something else to consider. And while some individuals who are experiencing brain fog might not have a medical diagnosis to explain what they're experiencing, I think it's important to take into account these are people who are not experiencing brain fog either. So I do think it's important that with brain fog, with cognitive fatigue management, you are really intentional with how you're using your energy. Now, again, if we love these games, do it. That's awesome. If we are doing them because we want to feel better and do better in our daily lives, we need to be working on the things we want to get better at and doing some task-specific training. Because again, I think at the end of the day, the biggest loss here is for people who are doing it to get better or to maintain cognitive skill, whatever it may be, we're using a ton of cognitive energy that then allows us to feel a lot more disappointed when we did forget that thing we needed to do, or I am having a more difficult time at work, or I am having a harder time communicating with multiple people at the same time. So if we love them, great. If we're doing them to improve a skill outside of that game, let's just do the skill outside of that game. And we'll talk about that now. Especially when we do something like a spoon theory where we're taking account of what we do all day. It doesn't really matter what that is. It could be something as simple as, showering and getting dressed and ready for the day, to managing a team at work, to spending time with your spouse, or having energy at the end of the day to communicate with your family. There are more than likely little places during all of that we can streamline a little bit. My favorite example is people are always like, I can't remember if I washed my hair in the shower, right? Like I'm going to wash it again. I don't know. So like, that's my favorite, easiest thing to fix. You take your shampoo, put it in your hand, and then you take that shampoo bottle and you put it outside of the shower. And then I'm going to spend 0 minutes wondering if I've washed my hair because the bottle's gone. I know I've done it. I'm going to move on to conditioner. I'm going to move on to my soap, whatever it is. But it's little things like that that do make a difference when each daily task has one of those things, right? I'm sitting at the table. I'm like, well, have I already taken my medicine? I guess I'll get up, check again, look at my medicine. Yep, I did already take it. How do I help eliminate that extra step, right? How do we streamline some stuff that is usually pretty automatic, pretty routine, but it's a big use of energy so that I can, one, maintain a quality of life I like, and two, work a little less on the basic stuff. We have big stuff we can work on that's unrelated to our daily routine. So let's spend our time and energy on something like that. Something I love touching on, and we'll touch on forever, is what normal aging looks like for cognition. Because what we will see too is we'll experience this brain fog and we may say, well, it's related to this or that. But if things persist or continue, that's where we want to start paying attention. So as we age, our brains certainly do as well, just like the rest of our body. Typical changes to our brain and to our cognition include things like walking into a room and forgetting what I walked in here for, right? What the heck did I come in here for? My favorite thing for this is also out loud narration. I'm going to get up from my desk because I need a pair of scissors out in the other room. And I'm going to say scissors, scissors, scissors until I have those scissors in my hand because I'm trying to make life easier. Another thing we'll see is forgetting where you placed a frequently used item. Where the heck is my phone? Now we can talk about streamlining those processes too, but again, this is a totally normal part of aging. And then when that word is kind of on the tip of our tongue, gosh, what is that lady? I know her name. You know, we see her once a year, every year at this one event. Gosh, what is it? The difference is really how often those things are happening. You know, if I'm walking into a room 2 or 3 times a day and that's happening, that's abnormal. Now, again, that may be brain fog, right? And that's exactly what we're talking about here. Forgetting someone's name I know well, right? The things that aren't normal are difficulty getting my daily tasks done. Am I leaving the stove on after I'm done cooking for hours at a time, multiple times? I will also stress this by saying we're all human and we're allowed to be a human. We all make mistakes. It's the frequency at how often I'm making those mistakes where the concern maybe grows a little bit, or, you know, again, we're here getting help talking about some of that cognitive fatigue. Forgetting common words, you know, not the lady I see once a year, but the lady I see 3 days a week at the office. That's something we're talking about. Repeating information in the same conversation, becoming disoriented in familiar places, somewhere I go often, all of a sudden I kind of can't remember where I am or how I exit the building. Mismanaging medications and doing it consistently. Over or underdosing, missing a full day of meds. And again, we're not just being human once, it's happening often. Forgetting to pay your bills. And again, that's a process we can talk about streamlining. For those who are comfortable with auto pay, it usually is everybody's best friend. It just works so that we don't have to. And missing appointments, right? Missing a doctor's appointment, missing a lunch with a friend, and not just once. Those are those changes where we still have people who will also go to their physician and say, this is happening. And they'll look at them and be like, you're just getting old. I'm here to tell you, none of these are typical aging mistakes if they're happening often. Now, again, that's not once in a blue moon. That's not, you know, once every 6 months, I forgot to do something. That's not it. If these are happening on a monthly basis, we want to be getting some skilled functional help. You know, I'll say this all the time. We don't have to needlessly struggle. There are things that can be done, but it's identifying them first and then getting help second that makes a huge difference. And again, there are some of these we actively see with brain fog. But if they're affecting my quality of life and my ability to earn a living or my ability to communicate with my loved ones, we really do probably need to look into some skilled assistance, because none of these are things that should be happening as a normal age-related change. And even if they're happening in conjunction with a diagnosis, we don't have to struggle that hard. So what happens now? Skilled therapy, certainly a speech language pathologist would be the person who covers the cognitive aspect of this. I do love a counselor. I do love other members, a neurologist if we have one and like one. If we don't like one, let's get a new one. I would be seeking some skilled therapy if certainly the last slide looked familiar, because we want to be making life easier and not harder. And if we leave them unaddressed, most of the time stuff just gets harder. We just struggle for longer than we needed to. Family support often comes with additional family education. One of my favorite things about the spoon theory, and I don't think I mentioned this earlier, is that it gives your family and your loved ones and your friends a different language. It's easy for a human being to look at you and be like, I'm tired. Well, yeah, I'm tired too, right? We're all living in a crazy world. I'm tired. Cognitive fatigue certainly as it relates to a chronic illness, is not the same. Your tired is a lot more difficult than my tired, and I'm tired. So when I look at somebody and say, hey, I'm out of spoons, I do not have the capacity to have this conversation or look at this report or do this thing, it's a totally different verbiage. And sometimes, especially when it's with our family, it doesn't have to be so formal. You can look at your husband. I look at my husband and I say, hey, I'm out of spoons. And he just knows, right? Because I've given him literature and he has to listen to me talk like this all day. But it is a hugely impactful difference for a partner, for a child, for an aunt or an uncle or a sister. Hey, and I will recommend this as well. And I didn't talk about this. I can't believe I didn't. I love scripts. They are phrases or sentences we just have ready to go that we can pull out of our pocket and lean on when we are in that moment of true, I'm going to hit a wall or I'm at capacity. And I kind of just gave an example of one, but one of them really might be if I'm talking to my husband, hey, honey, you know, this conversation is important. I don't have the capacity to talk about it. Can we talk about this tomorrow? Right? I don't have the capacity. I'm at max. And again, I'm a neurotypical and I do not have a chronic illness. And I say that. So for my people with a chronic illness or with brain fog or cognitive fatigue, totally appropriate. I do think you have to educate family. They just don't understand. Nobody knows because they're not going through it. Even if you have a wonderful, supportive, lovely family, they're not feeling what you're feeling. It's hard for them to come up with that empathy when they truly just don't get it. And they're not getting it because they don't want to. They just can't. So having additional literature or having additional stuff in written form that's still pretty simple, that allows your person to go, oh, I get it. You're not just tired. You know, this isn't just you don't want to deal with it. You can't for right now. It doesn't mean we're going to put it off forever, right? We can't get away with that, whatever it may be. But I love a script. You know, if we're dealing with we do quite a bit of caregiver work. So if you had a parent who had an illness you were also caring for, hey, mom, I love you so much. I'll give you a call tomorrow. And you know she's going to call you 10 more times. Hey, mom, I love you so much. That sounds great. We'll talk about it tomorrow. Hey, mom, sounds great. We'll talk about it tomorrow. And you just have it ready, right? It doesn't matter what the script is. I usually recommend a script for something we deal with often, right? It's a little bit more predictable. We're not coming up with a script for every single scenario we would ever have. But for the ones we know are difficult and maybe are going to come at a time where we're not at our best for dealing with it. I mean, I've had people who will print them out and tape them up inside their cupboard. They just open the cupboard door, or you can keep it on your cell phone where we have it in our notes. And it just, again, what can I do to save cognitive energy to prevent that brain fog from really disrupting my day? I do love environmental changes. And that is something like let me put a big giant calendar in the kitchen. That is, let me put a giant Post-it note on my door that says, and actually I have one next to my door. There is a huge sign in bright orange that says phone, wallet, keys. We love it. We hand it out to people. Because you do your pocket check as you're leaving the door, right? How many times have I left the house without the things I need? How do I help myself do less work and be more accurate and successful so that I can use that cognitive energy somewhere else? I talked about medical support a little bit earlier. A neurologist, I love a counselor for a number of reasons or needs. Brain fog is complex. It's not given maybe the validity it deserves often, especially when it's not, or even actually when it is coupled with a medical diagnosis. It's something that I think will gain more respect and attention down the line, but for those who are experiencing it now, the more providers we can get on a team to support you and validate your experience and provide functional tips, tricks, strategies, medication management options so that your life works better, the better. I always feel like I run weird timing, but any questions? I know that's quite a bit of information to consume, and I know it's condensed pretty good.
That was fantastic. And I was doing my best to take notes. And there was quite a few requests for the slides.
Okay.
So that's great. All right. So we do have questions. Um, and the first one is, how can you tell when it's meds or if there's really is a cognitive issue that needs to be addressed?
So it's a great question. If you're taking the same meds, if there have been no medication changes and we're starting to see a change in cognition, that's usually a good indicator it's not the meds. Brain fog, if we're on a pretty heavy pain med, if we're on a chemotherapy, those are the ones that are going to cause a big change. A couple antipsychotics, a couple anti-anxieties, but if we've been taking them consistently and they haven't bothered us before, now if they're new and the onset of the symptoms is new, that's where we may be saying, I would recommend always, 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 if we're concerned it's medication, we consult our physician and say, hey, I think it's causing this and this. Could we potentially change the timing, change the dosage, work through that together? And then if the deficits or the changes still persist, I am always going to be proactive. We can wait and see, but we're just going to wait and see things probably get worse, where we could be proactive, manage it. And if things got better in a week, well, perfect. But if they didn't, you're on the ball and you're proactively managing anything that's changing. So consult your physician. You can always reach out to a pharmacist as well. But if the meds haven't changed, but the skills have changed, I would recommend looking into it sooner rather than later.
Excellent. Excellent. Okay. 2 years ago when ill, I would think of something that needed done and a month later it would get done. The fatigue was so bad. Now that I'm much better, the big tasks get done, but I find myself putting off small tasks. Any insight or help for this?
Yes, I do this for myself. I have a 2-minute rule. If a task is going to take less than 2 minutes, I do it right away. You can also use an app then to keep track of those 2-minute tasks. And I really did love what Tamala maybe said last time, where it was like the days we feel good and we can get all those 2-minute tasks done. Let's do them. Great. But I do, if it's less than 2 minutes, I am the queen of procrastinating. I'm never going to do it. But if it's 2 minutes and it's not going to use all my energy, do it right away.
Great. Okay. Are there any dietary changes or additions that could make or that could be made to minimize brain fog?
I think there's a lot of people working on that right now. I think certainly if your body responds to different allergens, listen to those. I think it's a great conversation for your general practitioner or even like a gastroenterologist, but we don't see a lot of consistency for a healthy human implementing different diets and seeing different cognitive function, but I would lean on your physician.
Got it. Okay. Are there ways to distinguish between normal brain fog from aging and that attributed to some form of myositis?
So especially the last slide, I can't stress enough, even if we're calling it brain fog, like even if we're not going to call it something else. And I certainly regularly treat dementia, Alzheimer's, primary progressive aphasia. We treat, the stuff that is neurodegenerative in nature. The quicker we get on top of something, the more functional it is. So if we are experiencing anything on that last slide regularly enough to be like, I do that, call your doctor, get a referral to speech therapy.
Got it. So, and it really does, as a reminder, that it's the frequency. Like some stuff is normal if it happens occasionally, but if it's happening all the time, that's a different story.
And it's just going to make the brain fog worse, right? The harder I'm working to remember the basic stuff, I mean, you're working 10 times harder than you used to. So let's implement strategies. Let's get some help. You're just going to feel exhausted even more so than previously.
Yes. Okay, this is a great one. Is Prevagen effective?
So a couple years ago, Prevagen had a class action lawsuit out against them because their claims, again, were using neurotypical individuals. So people who did not have a diagnosis that suggested they had an abnormal change in memory or cognition. I'm I will say this as politically correct as I can. I think that the pharmaceutical market loves to sell things that work and loves to make them brandable. We would recommend, I think personally, I think they're pretty predatory. I think they are preying on, and they're expensive. It's not nothing. It's a lot for what it is. Ask your doctor what they think versus some of the FDA approved options and go from there.
Okay, great answer. And a good one, because, you know, we do get lots of people want to sell you everything under the sun, and it may or may not work. Okay. Is brain fog the reason I feel disorientated, off balance most of the time, or is it from my TBI?
If you have a TBI, one, I certainly recommend finding a speech therapist. Because I would say absolutely, if you have, we would want to see a couple medical professionals. If you feel physically disoriented or dizzy, we want a PT. If you feel cognitively disoriented, we want a speech therapist. If we've had a TBI, there is so much we can do from that perspective. Let's make life a little bit easier. See a speech pathologist.
Fabulous. What is the best method to remember certain words or names?
So names are a tough one. Names get everyone. So it can range anywhere from keeping a cheat sheet. You know, if we are going to the same monthly meeting and I know that I have a hard time with everybody's name, I'm keeping that cheat sheet on my phone. You could do a physical one. Phone's just a little bit more sly, I think, nowadays, because we just all have it in our hand. Otherwise, I love a mnemonic. So mine is Meaghan, starts with an M. You could do Maniac Meaghan, because I won't stop talking. Or, you know, whatever it would be, right? Same thing with a description. You know, I know that the woman with the beautiful long red hair, you know, she's so nice, she's so funny. That red hair, RH Rita Hill, whatever it may be. But you are going to have to come up with something intentional. It's never just going to pop. It just isn't. It's just not how it works. It's not going to get easier. That part is hard. That part is trained, where you're training over and over.
Gotcha. How much REM sleep is normal, and how much deep sleep do you need?
That is
Their doctor says you should have about 20% of your sleep cycle be in deep sleep.
That is so far outside of my scope of practice. Quite honestly, I wouldn't even want to guess.
Nope, that's okay. Hey, you know, I get it. This is a great question. Are you currently working with myositis patients now? And if so, what have you learned from them? Do you find that myositis patients are dealing with cognitive fatigue issues, old age issues, or an early form of dementia?
So I do see myositis patients. I see a very small number. So for me to make that generalization feels silly, but I will say when we look at other autoimmune diseases as well, we are definitely seeing, and it could be, you know, related to the autoimmune disease itself or just something that happens in conjunction with it, because things can just happen simultaneously. But we do see cognitive fatigue and we do see cognitive changes. I would imagine we continue to expect to see them. And
get up and take a 5-minute walk.
That would be my so when you were doing Alexa, cancel. So when you were doing your presentation, you set mine off.
I'm so sorry.
No,
I should have changed the name.
It's great. There you go. But hey, this was a great example of how it works.
She is
which
great.
is why I let it go.
It is perfect. I can't stress it enough. I obviously I love the tech. I think the tech is helpful.
All right. Back to the myositis question. Sorry.
Yes, no, you're great. That was perfect. I do think it's something that individuals who are diagnosed with myositis should pay attention to. I think if we were to experience it, it just makes life harder. So let's stay on top of it and implement functional change. And again, if you're experiencing that, let's get help. You know, I know that we are professional doctor appointment attenders. I totally get that. But I do firmly believe that the more you manage cognitive fatigue and implement strategies, the easier the rest of that is to handle. It's worth your time and energy.
Oh, absolutely. Absolutely. Anything that we can ever do to take back some control with a disease that we really don't have control over, in that sense, I think is always important. Looking for strategies for battling brain fog when most fatigued and tired.
So that is when you kind of want to lean on the strategies you have in place. So kind of like Tamla said in that last, on the days you feel good, what can I do today to set myself up for success when I feel horrible? Is that having all of my alarms and my meds all set out for 2 weeks even, right? They have the med boxes where we can set them out ahead of time. Let's do it. Let's have it ready to go and again, if you know you're not going to wake up on time for your meds to get up to the kitchen to get it, put it on your bedside table. And it's hard to plan, but if I know that I'm in a couple funky monkey days, can I have my spouse bring me some stuff? Can I have some, meals that are more readily available to go? I don't have to do any work. Can I rearrange or cancel a social event? What can I do to make life as easy as possible? Can I set up an automatic feeder for my cat and dog? What can I do when it comes to basic home management? Do I have a neighbor I trust and like who I can call and say, water my plants outside? Whatever it may be, but let's think about those things on the good day. So when you're feeling like crud and it's hard to remember and do extra stuff, but being like, oh my God, I can't do this thing. Okay, well, in a week or a month or a day when we feel better, let's talk about how we fix that thing.
I love that. I love that strategy of strategizing on your good day so that when you have the bad day, you're able to just be like, nope, 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 nope.
Yep.
I love that. And I am a huge utilizer of alarms on the phone and with my lovely device that went off, huge proponent of that because that way I don't forget.
It's so nice. It is.
Yeah. Okay, it says I have myositis. How do you deal with fatigue related procrastination?
Again, it's hard because I feel like once you're really good at procrastinating, it only perpetuates more procrastinating. So I do stand by the 2-minute rule to the best of my ability. Internal motivation is a totally different animal, right? In conjunction with cognitive fatigue. So it's tricking yourself, right? That's the name of the game always. How do I trick myself into doing this thing in a proactive manner rather than reactive? So lie to yourself about a deadline. I mean, what can we do to help change your procrastination nature outside of the brain fog too? If I tell myself that this thing has to be done by Monday and I know I have until Wednesday and I still do it Tuesday, at least I didn't do it Wednesday. You've got to trick your own brain there. There is something to be said about knowing how you operate and then helping yourself through tricking yourself.
Another trick that I find is if there's a series of tasks that I want to procrastinate on, is to write them out. And then I just tell myself, okay, today I'm going to pick one of these.
Love it.
And then at least it's like, okay, I've done. And sometimes having that choice of what procrastination task I'm going to choose makes a difference. So sometimes it doesn't, but that's okay. All right. Do you classify brain fog as including any physical symptoms such as pressure in the head or increased sound, light, other sensory sensitivity? Or would you limit the use of the term purely to cognitive functional memory?
Usually, and again, face value here, most of the literature I've ever seen is not including the sensitivities to the environmental stuff. We would certainly include those things when we are looking at an overall picture of your mental fatigue, but I would not be blaming brain fog on some of those. Now, would I suggest that being in a loud, noisy environment is going to make you less functional every day of the week? But are you going to have increased sensitivity to that noise and light as a result? I would be talking to a physician more about that, especially because of how it's mentioned even, and again, there's not great hard literature. You could go to the Mayo Clinic, you can go to Stanford, you can go to UCSF and look at, how they're defining brain fog, and it doesn't include those sensitivities. It doesn't mean we have a well-defined version of what that is, but I would be talking to a physician more about why you're experiencing that and look into that.
Excellent. Okay. What suggestions would you have for improving attention?
I love the Pomodoro method. You sit and work for about 25 minutes. A timer goes off. You take a 5-minute break. You work for another 25 minutes. You take a 5-minute break. You do that for an hour, and then you take about a 20-minute break. If we're having a hard time with attention, do you also need to remove those environmental distractions? Do you need to go put your phone in the other room? Do we need to turn off the internet so that you can get this one piece of paper done? Do you need to, what are the distractions, or what do you feel like pulling your attention? Because we need to alter those. Attention is hard, especially when it's brain fog at its core. Don't get me wrong. If I'm overly fatigued and it's hard to do that, we need to then build rest in, right? But if it's my phone's vibrating, or I'm going to check social media, or I'm going to look at my email, remove those. And then again, do it in spurts. I love a 25, 5, 25, 5, 25, 5, 20.
Excellent. There was a comment in the chat here as well about you can block websites. So, you can, and I love the blocking the social media as well, because I agree that's a culprit to a lot of us, is you're doing something and then a message comes in and you're like, oh,
Yep.
and then you're like, wait, where was I? What was I doing? So
Yep.
yeah,
I put
great.
my phone in another room. Like I can't. I don't have the
I
nice
love it. No, it's a great suggestion. It says, if you're starting a job that requires high cognitive load, what might be able to negotiate changes or accommodations to the position? Are there accommodations or strategies that you suggest?
That's a fantastic question. Additional time is always the first one that comes to mind. What does your training process look like? What do your deadlines look like? Oftentimes they can't change those for a whole company or an individual instance, but can you get, additional time? Can you get, do you need a specific type of computer? Are you in the office versus at home? Time's usually the one that comes to me first when it comes to accommodations. And I think that's more scholastic than anything else. I'll look into that. That's a great question.
Okay. And I have this person's information.
Yeah.
So if you come up with a better answer, or like a more, I shouldn't say a better answer, because your answer
more comprehensive,
great.
more comprehensive,
like a more
for
comprehensive
sure.
answer, then we can make sure that gets there, because I agree that I think that question pertains to not only work, but also school.
Oh,
Because
school.
there's a lot.
I've got a lot for school, but yes, yeah.
Because there is a lot of accommodations that need to happen for school. Because we have, myositis doesn't just affect one age demographic. It can affect, we have little kids that get myositis, and we have young adults that get myositis. And so I think,
well, and so another thing then would be to, now that you've really opened that up, I would request you if you could record meetings. I would request if you could record like any of your learning or training, or how accessible any of that, because that's for school for sure. I mean, go record a lecture, receive the lecture notes ahead of time. Same thing with the training. Can I get my handbook beforehand? Can I get what's expected of me beforehand? Yeah, I would be using visual supports again as quickly as you could get information. I would request it.
Yeah, no, this is great. And like I said, we can work on a more comprehensive answer, because I think that's a question that's going to come up often, and be something that continues to come up. So how do we know where to start to battle brain fog? It seems so overwhelming and heavy.
It is. So the fact that you're here is a great start. Tons of bonus points for even looking into it. I couldn't recommend the spoon theory enough. I do think it's funky for the first 2 weeks. You really have to commit to it. If you don't, it doesn't work like anything else. I also think reaching out to a professional, again, cognitive training with a speech therapist is certainly my #1 recommendation. If your speech therapist is not great with cognitive training, or it's just not their specialty, ask for a different one. Because again, we either know how to do it or you don't, and there's really no in between. But I do think getting additional professional help is just that helpful.
Yes. And this is a question for you. Would, obviously our brain fog and cognitive fatigue is not dementia. I mean, some myositis patients do have dementia, but would reaching out to somebody who works with dementia patients be helpful, or is that not?
It should be in theory, right? Because what we're going to do at the most basic level of this is like certainly with dementia, we're looking at progressive functional changes. We're also trying to stay on top of or ahead of. But at our basic core, it's when we talk about cognition and we break it down into what it is and what it does. Somebody who's working with cognitive changes should be able to work with a TBI patient or work with a myositis patient because we understand how cognition works. We may have different strategies or tips and tricks. You're doing a lot of different stuff for, especially as dementia progresses into later stages, than we are with somebody who has myositis and is working part-time and is managing a family. We're doing way different things. Don't get me wrong. Ask if they know about cognitive fatigue management. I would just ask outright, hey, this is what I'm doing. I'm a high level, working professional, but this is what I'm needing.
Yeah, it was just I wanted to ask that question because sometimes we may not have a speech pathologist in our area that is trained, but we might have some dementia or Alzheimer's centers that have staff that are trained. So that was my question.
Yeah, and we love, we work pretty closely with centers, but quite honestly, they are doing totally different things because telehealth is still a pretty valid functional use. I would be Googling for speech therapists that specialize in cognition in your states.
Good.
TBI is a great one to look for. A TBI specialist is doing this beautifully.
Okay.
So if we're looking, I'm Googling for teletherapy because it's really functional and also saves a ton of cognitive and physical energy getting to and from a clinic and fits nicely in your schedule. So I would be Googling, high level TBI speech therapy.
Excellent. Thank you.
Yes.
Let's see. Should you do more complicated tasks in the morning when you are better rested?
Such a great question. Yes. When you feel the best, do your worst stuff and then save the easy stuff for later. It's also then how we go about planning our week, right? If we know we have a huge giant thing Thursday, can I do all the little stuff Monday, Tuesday, Wednesday so that all I have is Thursday so that I'm totally ready to go and done Friday? Yeah, absolutely. Energy management throughout the day is a big deal. Harder meals in the morning, harder anything in the morning, and then coast through the rest of the day.
Excellent. Okay. No, that sounds fantastic. Well, that wraps up the questions that we have. Awesome. Any last things that you would like to say or address?
No, just thank you so much for having me, guys. I hope this was helpful, and it's always a pleasure to get to work with this community. Thank you.